So what I want to do now is just tell you a little bit more about the Capstone Project that all of the students in the program are going to complete. These are so fascinating, and they are the way that you get to pull all of the knowledge and all the things that you have learned in the program, most likely together with either work experience that you've had in the past, a burning passion that you have that brought you to the program, or some issue that you've learned about in the program that you've really wanted to develop that sort of captured your interest during the program that you want to follow up on. And so basically what happens as a part of your Capstone Project is that pretty early on, once you start, and if you're in a one-year program, really early on, we ask you to start thinking about this capstone, as many of you know who've done the application, when you apply. And we start thinking about who would be good mentors for you, who we want to pair you up with, and start just like identifying how we're going to guide you through the program based on those interests. And then we're going to ask you to solidify that interest pretty much in the beginning of the second quarter. And then what we do is we put you into groups based on your interests. We pair you with a particular mentor and a capstone advisor as part of that. And then you work over the rest of that year. And if you are in a 2-year part of the program, then you do it as your second year. And so this is a way to really dive deep, to ask the questions of the experts around the country that you wanna ask, to match up with people at UCSF that are leading experts in the world on these particular topics, talk to lawyers, talk to people from the FTC and the DOJ or whomever it is. We really go pretty long degree to put you in touch with the people that you need to talk to get at the issues that you're studying as a part of that. And so I want to tell you a little bit about some of the work that our students are doing, because I think it'll give you not only a sense of the breadth of interest in this program, but also the depth of these projects. So one of the students that I'm working with currently is an RN, and he is working on scope of practice laws, and he has basically studied scope of practice laws. And scope of practice, for those of you who don't know, is the law that tells you, sort of what the range of any practitioner in the medical field can do. And so if you're an RN or you're a skilled nurse practitioner, there are certain laws about what you can do. And so he has gone through all 50 states and looked at all of the laws in each of the 50 states and has looked at the leading, most cutting edge changes to those laws being brought on. He is writing model legislation, and he's writing a white paper to sort of guide policymakers to say, here's why this is important. He has gathered and synthesized all of the relevant evidence demonstrating how effective nurse practitioners and RNs can be, and sort of how they fare on patient satisfaction scores, how they fare on patient outcomes, and then married that to build an argument for why scope of practice should be broadened and why certain levels of RN should have greater autonomy in states, and how that will benefit overall cost of care, how that will reduce overall cost of care. And so making the argument from a range of things, and then putting together, not only with this white paper, also putting together sort of an executive summary for policymakers and model legislation to hand over as a significant package. So that's one project. Another project is a project dedicated, and the author of this project is in the room, so she's going to listen to me semi-botch her project. But you should really talk to her about it, because it is incredibly in-depth, and Katie has stopped at nothing has stopped Katie in trying to talk to everybody who knows anything about drug pricing. And she is really dedicated to figuring out at a federal level different ways to bring down the overarching costs of drugs. And it's an incredibly good time to be doing that, because the Trump administration happens to be really interested in lowering overall pharmaceutical costs. And she's coming at that from a number of different ways. She's looking at, are there economic policies and strategies and ways that you can do that? Are there different laws that you can pass in ways to do that? Are there reference pricing models that you can put into place? And she has talked to people that work in, that are FDA lawyers. She's talked to people that are in the pharmaceutical industry to figure out how they set their prices and what are the mechanisms that are being used. She's looked in depth at pharmaceutical benefit managers and how they engage in pricing and their role, and I think has written a really compelling, or is in the process of writing, a really compelling argument that there are a number of different things we can do from a legal and policy-oriented basis to change the way we price pharmaceutical drugs. And I think something really big is going to come out of her paper. So I think that is a pretty exciting thing. And then finally, I just want to tell you about one other project, which is being done by a physician who is in our program, and she is really interested in improving overall patient encounters with their physician. She's looking at shared decision making and the way that patients make decision, and how the 15-minute office visit with a physician really constrains the way that patients understand their disease, understand their treatment, and really hinders the way that patients sort of engage with their treatment and adopt it. And so she is thinking about ways to use social media and phones as a guide to helping patients get more information in advance of their physician visits, incorporate that so that the physicians can basically push them information that they need to have, and then have a better conversation with the physician in that time period. And she's looking at changing some of the laws and some of the recommendations for physicians in practice, and how to really get at physicians in practice. And so there's a pretty broad range of topics, of interests, and of potential strategies for how we're going to go about solving some of these problems. But each student has brought sort of a piece of their past and history to these projects, and they're turning out really fantastic.